Welcome everyone, this is Ashley Klein from Prevent Connect, and I'm excited to be here today for our Prevent Connect Campus Web Conference, Keeping Climate Study Data and Other Reports Off the Shelf, How to Use Data to Inform Sexual and Relationship Violence and Stalking Prevention Strategies. Prevent Connect is a national program of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So we do have some learning objectives today, and I think I mentioned this earlier, but I'm really excited about this topic because I think this is something that a lot of us have struggled with, and so I'm so happy to learn about the benefits of using data to inform our prevention strategies, how we can identify the different types of data that can be used to inform prevention strategies. We're going to talk about strategizing how to use various forms of data to inform prevention, and also look at how we can use campus and community partners to collaborate with in order to really maximize the application of data findings into prevention strategies. And finally, really understand how this data can be used to identify trends and themes associated with different student populations in order for us to really tailor our prevention strategies and be specific to the communities that we're working with. So with that, I would love to know, before I pass it on to our wonderful facilitator today, what specific role do you play in campus interpersonal violence prevention? So I'm going to put that question in our text chat. And this is a good way for all of us to practice using this if you haven't already. But we'd love to know, what is your specific role? Maybe you're an off-campus partner. Maybe you are a prevention practitioner on a college campus. Maybe you're working in Title IX. There we go, Title IX coordinator. We have a coordinator for violence prevention programs. Folks working in the prevention office as prevention educators. Research and consulting. Title IX coordinator again, off-campus partner and funder, prevention educator, Title IX coordinator. We're seeing all sorts of different roles that you all are playing on campus when it comes to preventing sexual and interpersonal violence. And so we'll see that there's a good mix of folks who are off campus and on campus. So thank you all so much for answering that, and I'm still reading your responses. Now I'd love to introduce our presenters. So we're so happy and excited to have Jane Stapleton, Executive Director of Practice at Prevention Innovations Research Center out of the University of New Hampshire, joining us today to lead us through this topic. Jane, how are you?
I am so good.
Yay. And then we also I'm super excited to hear from Leslie Fasone, the Assistant Dean of Women's and Gender Affairs in the Office of the Vice Provost and Dean of Students at the Indiana University of Bloomington. Leslie, how are you today?
I'm great. Thanks, Ashley.
Wonderful. So Jane, I'm going to go ahead and pass the podium over to you, and you can take it away.
Great. Thanks so much, Ashley and Leslie, for joining me, and hi, everyone. When people were putting up, and they're still coming through, what their roles are, either on or off campus, specifically related to sexual and relationship violence and stalking prevention or response, I was sort of reflecting on how much I really love my job. So I'm the Executive Director of Practice at Prevention Innovations Research Center, and I love my job because I get to do the two things that I love the most. And that is research, and then working with practitioners to integrate research and evidence-based practices and response and prevention into their work. And so I'm so excited to really share with you some of the work that Prevention Innovations has been doing over the years, as well as some of my specific work in really working with campuses and practitioners and really thinking about how can we use data to inform our prevention strategies. And actually the idea for the topic of the web conference came from me actually tripping over a pile of data reports that sort of sit in my office really as sort of like markers of I pick them up and read them and put them down literally on the floor because I don't want to put them on the shelf. So I'm excited to present. So I wanted to just begin by just framing when I think about data and the role that data can play in prevention. I wanted to just share with you, at least for me, what it means to use data to inform prevention. So there are three sort of main headers, and I'm going to share with you today a lot of kind of strategies to do this, as well as the benefits. And I had the opportunity to do a big consultation project with Indiana University Bloomington a couple of years ago, and I'm so excited for Leslie to share in practice how they've integrated data into their prevention work. So for me, what it means to use data to inform prevention is really sort of developing prevention goals, objectives, strategies, and implementation activities based on data from multiple sources. And I'm really excited to share with you some of the multiple data sources that I've used, and I'm really excited to hear the ones that you've used as well. Whenever I think about integrating data into our prevention work, I also want to remind you and, remind the folks that I work with that it really is an iterative process. So for me, data that informs prevention is also prevention that informs data collection, data analysis, reporting, and dissemination. So it's really this reciprocal relationship. And to really incorporate data and infuse data in prevention, it really should involve a multidisciplinary group of individuals from on campus as well as off campus, departments who are practitioners, stakeholders, target audience members, and researchers, evaluators. So in thinking about kind of providing a framework for using data to inform our prevention work, I also really just wanted to stress that my comments are really within the context of comprehensive prevention. And I know that actually Campus Connect, Prevent Connect did a great webinar earlier this year on what does it mean to do comprehensive prevention. And Leslie and I have actually put together a resource sheet with some of the information that we're going to share with you. But I wanted to at least highlight the elements of comprehensive prevention that I think are very much grounded in the work that I do in integrating data into prevention. So comprehensive prevention is really it's grounded in the principles of effective prevention. So what we know works in prevention, and one of the really important things about that, or two of the important things, are that our prevention work is driven by theory and that it's informed by data. Comprehensive prevention is also, it encompasses primary, secondary, and tertiary prevention strategies. It's really important that our prevention really occurs at multiple levels of the social ecology, and that we really focus on building protective factors and reducing risk factors. And you can see the social ecological model on the screen. Okay, so Ashley's going to ask a question.
Yeah, so thank you, Jane, and thank you for highlighting that Prevent Connect Campus Web Conference. I did put a link, and I know it's on the list of resources that we'll be providing as well. So for you all, we would love to know how many data reports have never left your shelf. So we'll ask you to answer. On the left, you should see a little feedback box where you can select, and maybe 0. Maybe you either don't have any data reports or you're really good at not leaving them on yourself, but maybe B, 1 to 2, C, 3 to 4, D, 5 or more. Maybe there are dozens. And so I am going to share these results with you, Jane, that are coming in, and you should be able to see those. So it looks like about 50% of folks are saying they're 1 to 2. We do have about a third, a little more than a third, saying 0, but 5 or more, 11, 13, oh, it's changing. People are changing their answers, 14%. So are you surprised with these results, or what do you make of that?
Well, no. So I want to ask the folks who said 0, so use your hand status here. For those that said 0, raise your hand if You don't have any reports on your shelf because you don't have any reports.
And we are seeing some hands go up.
Okay, yeah. So for the people who are raising their hands because they don't have any data reports, hopefully by the end of the web conference you will have some direction on why it's so important to find at least one data source and maybe where you can find that. And for those of you that don't have any data reports on your shelf because they're actively on your desk or your table, or you're like me, you carry 3 of them around in your bag, that's really just wonderful. So I'm actually not surprised by the number of reports that are on people's shelves, partly because I think one of the reasons why, and this will be another question a little bit later on, but this is more from a researcher evaluator point of view, that a lot of times researchers or evaluators do write reports and conduct studies, and they don't have a good plan or a good mechanism in place for really then translating the data findings or the research findings or the evaluation findings to practitioners in a way that they're really helpful and useful to practitioners. And so one of the things that I do, not only with practitioners but also with researchers, is to really help them think through, this is an amazing research idea that you have, or this is an amazing study, or this is a really important evaluation, but how can we make sure that both practitioners are informing the data collection and the analysis and the report writing and the dissemination, but how can we make sure that it's really usable for them when the evaluation or the research is done? So thanks for sharing. So hopefully, again, for those folks who have the reports on the shelf, hopefully they're reports that are still timely, and as soon as you leave the web conference, you will run back to your bookshelves and take them all off. Okay, well, I want to talk about some of the benefits that I see to using data to inform our prevention strategies. And then we'll talk about sort of strategies and what are some of maybe the barriers that you experience, as well as what are some of the data sources that you use. So there are many, many benefits to using data to inform our prevention strategies, and some of them are quite specific to an individual institution. So I've tried to just highlight about 6 benefits that I see that I think probably apply to most of us. So really understanding the extent and the context of the problem or problems, and I know today we're sort of focusing on campus interpersonal violence or sexual and relationship violence and stalking, but it is important to identify what exactly is the problem that the data is about. But so understanding the extent and the context really helps us design prevention strategies that specifically address the nature and the extent of incidence and prevalence. And I think that's very much related to the goals of comprehensive prevention, where ultimately we're teaching people skills to not only increase their knowledge and their confidence of engaging in these prevention strategies, but ultimately to prevent sexual and relationship violence and stalking. So data also allows us to highlight diverse communities' needs, identify gaps, and pinpoint specific opportunities for prevention. And I think, I know Leslie's going to give us some examples of how their campus did this, but I really can't stress this enough, that the really wonderful thing about hopefully much of the data that you have is that we should be able to really break down the data by specific demographic groups so that we can get a very real sense of what are the diverse needs of your campus community. So data allows us to identify communities' readiness for change and their readiness to engage in prevention, so that prevention strategies can appropriate prevention strategies can be applied, and really that allows us to meet the community where they're at. And instead of sort of a blanket, the same prevention strategy for every campus, there are unique features or stages of readiness on campus. So it's really important to be able to meet the campus and the community where they're at. Assessing needs and gaps really provides a roadmap for moving forward in very planned, strategic, and coordinated ways. And this really provides valuable information on how to develop and implement prevention strategies, really so that we can meet the needs and fill gaps. And when we know our community's protective and risk factors for sexual and relationship violence and stalking, then we can develop very specific prevention strategies to strengthen and build the protective factors and reduce risk factors. And a lot of times we sort of assume we know what the protective and risk factors are, and data really allows us and provides us with, the hard data to inform what are those risk and protective factors. So when we expand our data scan to really include other forms of interpersonal violence, such as hate crimes or bias crimes, hazing, and harassment, we're really able to connect the dots for shared risk and protective factors. And this, I think, is so important, and maybe some of you on campuses have experienced this, that we sometimes live in a very siloed world, particularly related to our prevention. So if we are able to sort of look at shared risk and protective factors, it really helps us move beyond the silos at our institutions so that we can really collectively create campuses that are safe, equitable, and respectful for all members of the community. And CDC has a great article, I think, that we put on our resource sheet called Connecting the Dots, that actually looks at shared risk and protective factors for interpersonal violence. So I wanted to, before we do another polling question, I wanted to just say a little bit about climate studies. And I think, as many of you know, actually, there's been a lot of talk about climate studies over the past couple of years, and we sometimes get a hint of whether or not climate studies will be mandated by either the federal government or by our own states. So I want to talk really briefly about climate studies and then begin to sort of move beyond the climate study. By introducing climate studies first and saying move beyond the climate study, I don't want to put out there that I don't think climate studies are important. I think they're very, very important. But they really, they just provide us with a somewhat limited view of climate on campus. And there are many other data sources that we can use. So it's really part of the data that we need, but I would venture to say that it doesn't provide us with everything we need. So I wonder, and again, with a show of hands, how many campuses have currently have already done climate studies or are in the process of doing a climate study?
And you see those hands
great. Yeah, a lot of hands up. Yeah, so that's really great, and so that's really wonderful. I think climate studies provide a great opportunity to really provide important information about our campuses. And there are some amazing tools that are available. And again, we've put together resources that you can look to, many of which are free. So please look at the great information that's there about climate studies. So typically climate studies measure the extent of the problem. Again, sexual and relationship violence and stalking. There are some tools that are out there that actually also measure other forms of interpersonal violence, whether or not it's hate crimes or bias or hazing, et cetera. They also measure the context of the problem, disclosures and reporting, perceptions of campus climate, and knowledge of policies and resources. There certainly can be other things in climate studies, but for the most part, that's oftentimes what climate studies will measure. And they're oftentimes collected through survey, whether or not it's online. There are some paper surveys I'm aware of that are happening on campuses, but they're typically quantitative surveys that may have some qualitative responses, but typically they're quantitative.
Great. So thank you so much, Jane, and we want to hear from our audience. Again, what data have you used beyond campus climate survey data? And so if you would let us know in that text chat, what else have you used? Amy saying that the Missouri College Health Behavior Survey, Haven and Alcohol EDU are some of the other data that they've used. John says NCHA. Oh, a couple folks are saying that, and that's the National College Health Survey.
Right.
Assessment survey, yeah. Molly, again, the Missouri College Health and Behavior Survey. We have data from our online community concern forms that Laura is using. Melissa says community readiness assessments out of CSU, which I am thinking Cal State University's Tri-Ethnic Institute?
Colorado. Yeah, Colorado.
Okay.
Yep.
Campus Clarity, Think About It data, Youth Risk Behavior Survey for high school, NOLA says, the Illinois Rate Myth Survey. There's a lot of stuff coming through. Again, another Think About It, online training from Campus Clarity, Clarity Report data, Heidi says. And again, the College Health Survey, Lynn. So thank you all for sharing those. If there's others, we'd still love to hear what you've used beyond a campus climate survey to collect data. But that is what we have at this point, Jane, from our audience.
Great. Awesome. So, Leslie and I came up with, just brainstormed the list, and many of the data points that you mentioned are here. So I'll just sort of share these. It's awesome to know that institutions are using the National College Health Assessment, and a few people mentioned if you're at a high school, youth risk behavior surveillance survey. That's a wonderful data source. Your Clery data is also really a great source of information, although clearly we know that there are some limitations to the Clery data because it's only data that gets reported. It's not necessarily an assessment of what's happening. I don't know that I saw anybody using campus and or local law enforcement data, but that's also another really great data source. Data from your conduct office or your Office of Community Standards or whatever office is responsible for adjudication of sexual misconduct cases. Hate and bias crime data, whether or not it's coming from your institution or maybe your local law enforcement. The National Survey on Student Engagement data, I think, is a great data source, particularly related to protective factors. Clearly there's national research that's being done in general on campus populations or trends. Some campuses use social norm surveys. If you haven't looked at any of these other data sources or thought to look at them, I would really encourage you to think about it. I know, and I said think about it, and I know that a few of you obviously are using the Campus Clarity module, Think About It. Some of you are using Haven or Every Choice Matters, and so I know they all have data elements as well, so that's great that you're using those data sources. Okay, well, I wanted to just talk about 3 specific other data sources which actually were not mentioned, and I just want to highlight them. So needs assessments, really, they determine the extent of the problem, needs, and gaps. And some of you might know needs assessment as gaps assessments, but essentially they highlight, or the data points that they oftentimes look at are awareness of or perceptions about the problem, access to resources, support and prevention, as well as the need for resources, support and prevention, as well as gaps, and then attitudes about how to prevent the problem and who should play a role. Typically, the data is sort of a mixed methods. So sometimes needs assessments are actual one-on-one interviews or conducted in focus groups, sometimes through observation and or sometimes surveys. A few of you mentioned community readiness to change, which I'm so really excited to know that some of you are using those assessments. And again, we put a couple of really great resources in our resource sheet. So readiness to change, or I know I have colleagues at UNH who have developed a readiness to engage in prevention assessment. So essentially this is an assessment that measures the community's level of readiness to change or to engage in prevention. And the readiness levels really range from no awareness of the problem at all to really a high level of community engagement in stopping or preventing the problem. And so it identifies the stage of readiness that best describes the community. And the idea is that if you're able to identify the stage of readiness, then you're much more focused on what are the prevention strategies that match the readiness. So you're essentially making sure that you're implementing prevention strategies that really meet the community where their readiness is at. Colorado has a great sample of how to do this. Sometimes readiness to change assessments are done, again, in interviews, focus groups. I have observations here, but actually that's incorrect, or surveys. Really a great tool. Something else, and I don't know that I saw somebody or anyone put this on the text chat, but evaluation data is also are really important sources of data that ironically I think that some practitioners do at least program evaluations, and sometimes we're challenged to even incorporate the findings from program evaluations into our prevention work. So essentially, evaluation data really provides information on the development, the implementation, the quality, and the outcomes of prevention strategies. And I've listed just 3 types of evaluation here. The first one is formative evaluation, and that really is done as you are developing and sort of testing the implementation of a prevention strategy. And this is, again, a very iterative process where you evaluate the development so that the data then informs kind of the final product. Program evaluation really determines the quality, the value, and the significance of a prevention strategy. And then outcome evaluation really answers the question, does the prevention strategy work, or are the anticipated outcomes realized or accomplished?
Great. So we want to hear from you all again. I'm going to put up our feedback box in the left-hand corner on the bottom. So to what extent have you used data to inform your prevention efforts? Maybe not at all. You have not done this at all. B, very little. C, somewhat, and D, quite a bit. So if you would choose the answer that best represents to what extent you've used data to inform your prevention efforts, and we are getting, and I should be sharing the results already. So Jane, you can see what's coming in. We have about 40% of folks who are saying somewhat. They're
That's
somewhat
great.
using data. Yeah, about 9% not at all, and then we go to even 32%, quite a bit. So,
yeah.
You know, again, I want to ask, is this surprising, or is this kind of in line with what you expected?
No, I think it's in line with what we expected. I mean, I think more and more people are using data, and I think it's wonderful to see that it's almost broken into thirds, so that that a third are using data to inform prevention strategies. Quite a bit is really encouraging. I'm thrilled to see that, and so I actually, as we move through the web conference, and when we have questions, I would love to, if people are willing to share kind of lessons learned or questions, I would love to hear from folks. So that's really encouraging. And for folks who are, using it, data very little, I think that there oftentimes are reasons why particularly practitioners are challenged to use data. So again, hopefully you'll gain some insight from our conference today, and I'm happy to share thoughts with folks offline as well.
Great, and that kind of goes into our next question that we'd love to hear from you all in the text chat, or what are those barriers of using data to inform your prevention efforts that you've experienced? And again, as Jane said, we'd also love to hear those lessons learned. Leslie says time. I think time, makes a lot of sense. Dawn is echoing that with time. So if you all would just head over to that text chat and let us know what the barriers are. Haley agrees. We just don't have enough time. Too much time spent on implementing rather than planning, Amy says. Resources, people is one. Not having a research background. I think some of this can be a little bit daunting, and if you don't have that background, maybe not thinking that you know where to go or how to go about it. Courtney says students don't participate. Emily, getting comfortable with jargon. Laura says time, both staff responsible for prevention and our institutional research staff. Some people have the expertise, but no one has the capacity. Again, more resources, including time and funds. Lauren says unclear how to use the data. So I think it's kind of what you opened with, Jane, is that it's great to have this data, but if we don't understand how to use it, it's probably not going to leave the shelf.
Right. Yeah.
Yeah. So thank you all so much. LB says if the data doesn't make the program or university look good, it's politically challenging to share it. That's another. Yeah. That is a barrier.
Yeah.
Great.
Yeah.
Well, thank you
Good.
all.
Okay. So I want to thank you, everyone, for sharing, and all of the things, at least that Ashley just echoed, and I'll look more closely at the chat as we move on. But many of the things you shared, I think, are common barriers, and I think I can't personally, for you, do a lot around particularly resources and kind of getting more staff or more money, but I think a really important strategy, and maybe you can try to use this to get more staff or resources with your administration, is, particularly for those of us that are at colleges and universities, we're in higher education where having data and being able to demonstrate what needs are based on data, or what the incidence or the prevalence is, so that we can make a case for which communities or which populations need prevention the most, or if we're able to demonstrate that a particular prevention strategy is effective or not. We should really use that data as a leverage point for our administrators to really say, investing in this prevention strategy, or better yet, hold on, I'm going to get my next slide, a comprehensive prevention strategy is a good investment for the institution. And so I would just really encourage you to sort of refine that little speech that I just gave about how data can really provide an anchor for a good investment for the institution, is really just so important. So all of that is really, all of the barriers, again, really need to be contextualized within our understanding of comprehensive prevention. And I think for the folks who said they don't have time, I think, and again, many of you know this, particularly if you're directly doing prevention, that prevention takes time. It really does, and we need to also tell that to both our key stakeholders, but also to our administrators. So I want to offer some strategies for using data to inform our prevention, and again, just emphasize that our prevention really needs to be comprehensive, which means it needs to be planned, strategic, coordinated, and evaluated. And so our data should really inform both the understanding of as well as strategies to prevent the problem. So I'm going to share some strategies with you. I think it's really important to establish a working group of researchers, practitioners, preventionists, target audiences, and key stakeholders to really identify and or create data sources. It's important to develop partnerships with faculty researchers, institutional research, assessment evaluation teams, particularly for those of us that maybe we're not researchers and we don't understand the jargon, or we don't know how to interpret the findings of an analysis of variance or a pre and a post test. It's really important to engage those people, hopefully at our institution, or if not, independent consultants who are working, doing research and evaluation. I think it's really important to develop an inventory of all potential data sources, and part of that would really include a map of who informs the tools and the data collection processes, who analyzes the data, who's responsible for dissemination of the findings. Just even mapping that out for our own campuses can help provide a better picture of what are potential data sources. I think it's really important to forecast what data you can mine or harvest to inform your prevention, and determine what and if there are additional data to collect. Many of you talked about time, and so I think developing a realistic timeline with incremental and realistic goals that includes data collection, analysis, reporting, and integration into prevention. And for those of you that feel crunched for time, or that the process of kind of collecting the data, or at least interpreting the data and finally integrating it into prevention, if that's going to take a year, then what are the benchmarks along the way that really will help sort of mark your team moving forward? Create a plan to disseminate data findings and coordinate efforts with the working group to really analyze and assess how to integrate findings. So I want to highlight some of the campus and community partners before I turn it over to Leslie. We've already talked about faculty researchers. Many of you have graduate students who are also on your campuses who can maybe assist you, even if their areas of expertise are not sexual and relationship violence and stalking. I would really encourage you to sort of seek out faculty who would be willing to work with you in, again, either collecting data or interpreting data. Certainly, there's great external evaluators, institutional research, assessment offices, community equity and diversity offices, including Title IX and compliance offices, student academic affairs, multicultural student affairs, athletics, Greek affairs, student activities, international student scholar offices, the folks who collect Clery data, or campus security or police, or community-based organizations, as well as others. So I have two more slides, and then I'll turn it over to Leslie. I think that what's really important in this process is to do strategic planning. And again, that gets back to my piece around comprehensive prevention is planned and strategic. It's really important to bring this working group together with other key stakeholders to really strategically plan how to use data to inform prevention, and to structure a planning process around the presentation of data, as well as the identification of all prevention strategies on campus. Really, it's important for the working group to really see the data to inform their understanding of incidence, prevalence, needs, gaps, risks, protective factors, and opportunities for prevention, as well as what works in prevention on your campus to develop those comprehensive prevention strategies, which I said. Questions to ask are, what do the data tell us, as well as what do they not tell you? Who else? What else do we want, and what else do we need to know? Who and what is missing from the data, and where can you get this information? It's really important to sort of, once the data is presented, to really think about what are we missing here. I think it's really important to do an environmental scan of prevention that really sort of looks at all of the prevention elements on your campus, looking at how does data inform those prevention strategies, including the goals and priorities. What are the goals and priorities, and why are they included? In looking at your prevention strategies, think about who's included and who's excluded and why. Identify all the strategies that are developed, that are in place, particularly to determine what level of the social ecology they intersect with. Talk about the language that's used in these policies to talk about prevention and survivors and perpetrators, and look at how consistent that language is across prevention strategies. And again, focus on goals and priorities, and ask the question, have these goals been achieved, and how do you know that? So ultimately, to keep the data off the shelf, you need to develop a plan that really actively engages campus community to incorporate data into the development, the implementation, and the evaluation of all prevention strategies, including those that are existing and new initiatives, which hopefully have been informed by the data.
Great. Well, thank you, Jane. And there has been some discussion in the text chat with folks sharing, what has worked with these barriers. So thank you for those of you participating.
Yes, thank you.
Yeah, we are going to turn it over to Leslie now, so we can hear some real, lessons learned when it comes to going through this process. We would love to get a sense of what campus and community partners you're currently engaging in your prevention work. But while we do that, and as you think about that, we're going to go ahead and pass it over to Leslie. Leslie, I've just given you the podium. You can take it away.
Wonderful. Thank you, Ashley. And thank you for having me. A little bit about my background. I am the Assistant Dean for Women's and Gender Affairs, and I'm in the Office of the Vice Provost for Student Affairs and Dean of Students Office, and I've been in my role for about 2.5 years, which is really where what I'm going to talk about, that's about the timeline for when we started some of these initiatives. I am by no means an expert in this, and when I saw Ashley at the National Sexual Assault Conference, I told her I kind of felt like I had a little bit of the imposter syndrome in a way, because I feel like this work can get a little messy, we can get behind in certain areas, and so I'm someone who loves data, and I use data to inform our efforts on campus for our bystander intervention efforts, some of our alcohol prevention efforts, our sexual violence prevention efforts, and I collect a lot of data. I've used it for 5 or 6 years probably in my work, and so I value it. And even as I listen to Jane, I have some new ideas, or I'm like, oh, we need to do that in terms of organizing. So all this to say is that I think it is an iterative process. It can get a little bit messy, but that's okay, because I think that's a part of collecting data, using it to form our work, and then doing program evaluation and making changes along the way. So So in my role as the Assistant Dean for Women's and Gender Affairs, I was the co-PI on our climate survey, helped lead some of our prevention initiatives on campus and our coordinated efforts on our campus, along with collaborating with many of our other campuses that are Indiana University-wide system. I have my PhD in health behavior through the School of Public Health and my master's in counseling but have worked in higher ed for the last 12, 13 years. So that's a little bit about my background. And as I talk about some examples, I think this certainly applies not to just individuals working at a university, but thinking about when I talk about students, maybe those are the community members that you might work with at your agency. So I'm going to provide some examples, but hopefully you can figure out how this applies to the work that you do and take some ideas, some of our successes, and maybe some of our learning experiences as well. So our initiative really to dive into data a little bit deeper came before the Not Alone report. This is Note Alone report, but it's not the Not Alone report. And this is really after OCR, Dear Colleague Letter 2011 came about, and we were increasing our response rate. Those of us who work in prevention and education, and with one of my colleagues, Dr. Justin Garcia from the Kinsey Institute in Gender Studies, really we're asking, well, what are our numbers? Are our numbers similar to the national numbers of 1 in 5? What are the issues of sexual violence on our campus? What did students experience before coming to our campus, after our campus? And what do we really need to know in order to prevent sexual violence? So those are some of the questions that we were asking. And so as we were talking, we were throwing around different ideas amongst ourselves of what do we need to do, what could this look like, and I think the point was that we just started somewhere. And so we had this idea to create a campus climate survey before the Not Alone report came out, but then once we had the Not Alone report, which was literally about a month or two later after we'd already submitted funding for an internal grant, that really helped guide our efforts. But for us, we threw around some ideas. And so we submitted an internal grant for funding to our Women's Philanthropy and Leadership Council through our foundation for Indiana University. And through that grant, we asked for funding to conduct a campus climate survey, funding for focus groups on campus, a contract with Prevention Innovations to conduct a Readiness to Engage assessment. And that really came about when we called Jane and said, we want to do more work, what should we do? And so she recommended a Readiness to Engage assessment. And then following that, we used the data for a strategic planning session that Jane came in and did with us in May of 2015, where she also provided recommendations. So for us, it was we knew we needed data. We knew we needed more information. Where do we start? So we did start with a phone call with Jane and submitted requests for funding, which then we received and were able to actually put our ideas into action. And so really we took a comprehensive approach. So like Jane was talking about, we used a couple of different methods for data collection. So we began with the campus climate survey and then also followed up with focus groups and the Readiness to Engage assessment. And that was with her recommendation, but also to give us a bigger picture. And I think there's a great deal of value of using different methods for collecting data. And those are just a couple of the initial methods that we worked on, and I'll talk a little bit more about later. So we really used the Not Alone report for a guideline for the campus climate survey and then revised it. We also looked quite a bit at MIT's survey because they were one of the first universities that we had seen for guidance on the campus climate survey. I recognize that many colleges and universities probably have already conducted climate surveys or are in the process, so I won't talk about that too much now. But once we got the data back, we really organized it into a couple of different categories because that made sense for us as we shared the public report, which was about this time last fall. So our primary questions and what we looked at were students' experiences. So our forms of sexual violence, so not just sexual assault, but other forms of sexual violence and sexual misconduct. The role of alcohol and drug use. We're a residential campus. So for our campus, that was also very important, plus considering the national numbers. The location of sexual assault, student use of services, reporting rates. So that's when we really looked at students' experiences. And then other primary questions, we're looking at their attitudes and perceptions regarding sexual assault and bystander intervention. And so this was a category of our findings that we thought we could really use to help us better understand students' perceptions and attitudes in some areas and how we could use that data for prevention. So we had added some bystander intervention efficacy scales. We'd asked students about their experiences as a bystander, so either witnessing a situation where they could have stepped up to prevent sexual violence or also how many of them had had a friend tell them that they'd experienced sexual violence, and how did they respond. And then we also added the ward, alcohol, and consent scale because we knew that that was an issue on our campus. And then really the third category, which really this came from the Not Alone report, was looking at students' attitudes and feelings about their experience and trust at the university, what types of educational programs they'd attended or been a part of, feelings of connectedness, trust of staff, faculty, administrators, knowledge of resources, use of campus resources, feelings of safety. And so all that information has really guided some of our efforts in understanding. For example, our graduate students express less feelings of connectedness and social support at the university compared to our undergraduate students. So trying to identify, okay, that may not necessarily have to do with sexual violence, but also what does that mean for how we can improve our efforts to help graduate students feel more connected. Then what we did was took the data from the climate survey, and because I was one of the co-PIs, I'd been working on the data and so I know that this can't apply to everybody, but there's different ways you could do this. What I found was useful, so instead of doing the focus groups, we took some of the data and the findings and identified about 9 to 10 different categories of topics to talk with students. And we hosted an It's On Us Student Leadership Summit. We had about 50 students attend, and we had a topic with 5 or 6 questions underneath each topic for about 10 different tables that would guide our efforts. And I'm happy to share what we did with anybody if they're interested. But basically we had about 4 to 5 students at each table talking about, with different questions that prompted them to come up with ideas that we could then use to inform prevention efforts. So, for example, we had a table on messaging and education efforts. We had a table on how do we educate students to better support survivors, a table on resources, and a table on graduate student needs. That's an area that we definitely knew we needed to focus more on, so we had about 5 or 6 graduate students identify some initiatives that they recommended to us. So what we did at that summit is then each table shared their feedback and input, and then we worked with a student leader who collectively gathered that information and worked with other student groups to put into a report with recommendations for next steps. And so they called that the Student Voice Report. We're about to dust it off the shelf because it's been 1.5 years and are going to go back to the students and look at it to say, okay, here's what we've done, here's what the students have recommended, and what else could we do or revise? And I think that that's another key point. How do we get student feedback? How do we get student input? They are experts at their environment and their culture for whatever campus you're on. So how do we listen to them and facilitate dialogue and facilitate a process to give us input through that? So that was a different way. Instead of doing focus groups, we really changed it to a guided discussion, which was really impactful and informative for us. Then in May, I guess this was about a year-long process, we had Jane come in and work with us on strategic planning. We brought in those campus and community partners like she had identified before, and for us saying, who else do we need to have at the table to work with prevention? So that involves our first-year experience and orientation office, colleagues from different cultural centers and different agencies around campus to say, who else do we need to have? There we presented data from the campus climate survey, and then we had students present the recommendations from the Student Voice Report there as well. Jane facilitated our strategic planning session and then also presented a summary of our readiness to engage assessment. So for us, that really started the conversation and laid the foundation, and then from that and from Jane's recommendations, we were really able to move forward. So I would call this all a needs assessment. It was about a year-long process, but I think really, it's not as fast-moving as we'd like to be, but really helped guide our efforts and told us what we do well, which our readiness to engage assessment indicated that we are doing a great deal in sexual assault prevention efforts. Our efforts could be more coordinated, but then we as a university need to do more work on relationship violence prevention and stalking prevention, which is very clear from our readiness to engage assessment. So like I said, it laid the foundation for staff and colleagues to better understand the problem. The strategic planning session also created a framework for talking about prevention, and Jane really did that by coming to our campus and working with us. It also helped us to identify who else can be involved in prevention and other ways to work on prevention, and really expanded our framework in terms of that meeting of thinking about all these different opportunities. And so we've really shifted our thinking instead of just doing presentations, but what are some other ways to share our messaging and work and collaborate across campus and infuse some of these messages and prevention strategies in other forms. And provided us with action steps and recommendations for moving forward. From our initial efforts, which I kind of had identified that this is one of our first year of assessment, and from some of the student recommendations, we immediately changed the name of our student advocates to confidential victim advocates, because that was something that we clearly heard from students. And so that was a recommendation that really came out of the voice report from students and their feedback. We also made changes to content on posters. On our campus, we have sexual misconduct, sexual violence prevention posters in almost every bathroom stall except for one in the restrooms. And we saw a lot of student graffiti on our bathroom stall posters, and so we had a student who actually is writing a research paper on the graffiti from the bathroom stall posters. But something that we saw, so another way to collect data, was a number of students crossed out sexual assault and wrote in rape. And so for us, that told us our students wanted to see the term rape, but then they may not understand that our sexual misconduct policy applies to other forms of sexual assault beyond forced penetration. And so we've slightly changed some of our wording and dialogue on that material and content. We created a sexual violence prevention committee for our campus, and then are currently, based on Jane's recommendations, are providing training to staff and students on core messages for sexual violence prevention. One thing that we learned, not through our climate survey, but through conversations with students, and especially from the student voice report, was that students were not getting consistent messages, especially regarding alcohol and consent, that was not consistent with our policy. So something that Jane recommended that I would recommend to anyone to do would be to identify what are the core messages you want the educators on your campus to share, or that you make sure are included in every workshop or presentation. And then we've been doing trainings across with colleagues and constituents across campus to make sure that they're sharing those core messages. On a campus with 46,000 students, that's key for us. I can also see that being key and altered slightly for a community agency or for a campus that may have another size but really needs to engage other partners across campus due to lack of support from prevention educators. Some of our other efforts that we've been working on, and I'm curious actually with a raise of hand, how many of you have dug into examining trends or experiences by different subgroup of populations? So if you can just raise your hand to show me whether or not you've collected data by different groups or focus groups or a climate survey. Okay. A good number of you have. All right. So as Jane mentioned earlier, I think identifying specific risk and protective factors for different groups is key, and also tailoring our prevention efforts. What works for our fraternity and sorority students most likely is not going to be what we need to provide in terms of prevention education to our international students or LGBTQ students. So I found the data to be really key, so both data as well as focus groups, in helping us identify different trends by groups of students. So our initial climate survey report, we looked at it by graduate, undergraduate students by gender, which was already a clear description and showed us quite a bit of differences by gender and graduate and undergraduate students on campus. We weren't able to look at transgender students because the number was so small and could have been identifying, so that would have been problematic. But again, a group that we'd like to look into. And then we did sub-reports that we need to bring back up and use, looking at different underrepresented students. So African American students, Hispanic Latino students on campus, international students on campus, LGBTQ, and looking at what are the differences in terms of their feelings of connectedness, their trust of the university, their experiences of sexual misconduct, as well as maybe their perceptions and attitudes. So I think really looking at that data as well as what other complementary information do you have, I think can be really key to identify how do we tailor our initiatives for these specific groups of students. So for example, international students are one of the groups that we've been working quite a bit on, and really trying to understand, first of all, identifying what groups of international students do we have on campus, and then what are maybe the cultural barriers for coming forward. What are different ways that we need to explain things such as confidentiality to students, especially from specific cultures, and what are maybe the gender norms from that culture. Climate survey isn't going to tell us all of that, but really thinking about what's the different information that we need to know about different groups, I think can be incredibly important. And then what data do we have to inform those efforts? Somebody asked, within undergraduate students, did you look at this group as a whole or by classification? We looked at undergraduate students by gender, and looked at men and women, which is, I think we'd asked gender, not sex, in our survey. So we looked at it that way, and then we dove into specific groups. If you want to do that, you'll need to make sure that you have support to be able to look at the smaller groups in terms of statistical analysis support, which depends on if you use SPSS or just having somebody that's knowledgeable about the research. So we had a graduate student working with us as we dug deeper. And I think that's really key in terms of informing those efforts with different students. So from our survey and just our work on campus, and I'll say we as the collective, our relationship with our Office of Title IX, some of our faculty that we have on board, we had a smaller group of staff that talked about, reviewed the climate survey findings and are providing recommendations to the provost. So this is a collective we. We still have questions that our climate survey could not answer and that we still need to know about. Specifically for us, how do our students interpret impairment? How do they interpret incapacitation? How do they interpret drunk? If your campus or you work with a population where alcohol is a big risk factor for sexual violence, trying to understand that, and then what words do you need to describe, or how do you need to explain consent and alcohol use when you're doing prevention education, I think is key. One question we had specifically from our survey was students' understanding of stranger versus acquaintance versus a friend. We had a high number of individuals indicate that the person who sexually assaulted them was a stranger, more like 30% as compared to what maybe the national statistics show. So we had more questions. Well, how do students identify stranger? Maybe how are dating apps or how is social media changing this? Maybe was there alcohol involved or not? So that's an area where we would need to dig deeper and have more questions. Additional information about who is perpetrating the acts of sexual violence, trying to learn more about who it is. We didn't ask enough questions in our survey on that question. And then something that we found in our survey, as well as the AAU survey, when I looked to compare our findings compared to the AAU national findings, is that a large number of students said that they didn't tell somebody because the incident wasn't serious enough to disclose to others. So not just for our campus, but other campuses, what does that mean? Why do students feel like it was not serious enough to disclose? What is that trend or theme? And how does that impact reporting or prevention? And then there's more questions that we just have in general. So does vice intervention confidence actually result in students stepping up and helping? How do we measure that relationship? Maybe some researchers are currently looking at that. Maybe there's some national, there's some publications or research showing us that. But that's a question that we have, is how does that translate into helping? How do students help? Is the way that they help actually making a difference? And then also, are our programs effective and impactful? So going back to that program evaluation piece that Jane talked about, we do program evaluation. I think there's an opportunity for us to get more student responses, but again, just asking, are programs effective and impactful? And then how are we changing them to meet the needs of students, and is that a continual iterative process? So some next steps, I think for us, and I encourage you guys to think about, is once you have your climate survey or once you have data doing a needs assessment, is there an opportunity to conduct focus groups to better understand the results? How do you use other data that you have to inform your efforts? So we have the Indiana College Substance Use Survey. How does that inform our efforts in terms of alcohol use, which is an issue for us? Maybe there's other data like the NESI or the National College Health Assessment that you can have that can help inform additional efforts. We've also found that for us, feedback from hearing panels and sexual misconduct investigators is key. So we're trying to set up an opportunity to have them share trends and themes that they're seeing in the conduct process with us that work in prevention. And then also, what additional data do you need to have to inform your prevention efforts? So the Campus Climate Survey or any one survey can't provide you with everything that you need. So for us, we want to do more work with social norms with the campus and subgroups of students. So we're hoping to do some work in that area. And then when we originally started our bystander intervention program about 5 years ago, we conducted a needs assessment. So I'd really like to do that again to also see how have things shifted and how do students' perceptions shifted in that area. So sometimes I think we think that one campus climate survey is going to tell us everything that we need. No, I think there's other ways and opportunities for us to do surveys and to look at data that already exists, and then what else do we need to know and what's the best form to collect that information. So again, I think lastly, to wrap up, and then I think we have some time for questions, or what additional information reinforces what you already know? So think about what additional information do we have that reinforces what we already know, what else do we need to know? I've found that anecdotal data, conversations, or observations with colleagues further inform our work. Same if I go into a presentation for a group of students, what they respond, what questions they have, how they're interacting and asking questions about the content area, to me that's observational data. That's collecting just as much data and information to inform our efforts as an anonymous survey is. It just looks in a different format. And again, I think I've covered most of this, but again, what are the best methods for collecting this data? A climate survey can't be the end-all be-all. I know I tend to probably over-survey students, but then there's other formats. Again, like I described earlier, at Sun F Summit that we have for students, we did not have formal focus groups, but rather we had guided discussions that really facilitated the next steps, and that's what we needed to do in order to make our data and our information useful. What we've learned throughout the process, and I'm really reinforcing a lot of what James said, besides the fact that data collection and program evaluation can be a little bit messy at times, it really is an iterative process, and it's okay to continually make changes. I think for us too, when we conduct our climate survey in 2 or 3 years, again, I don't know when it will be, but when we do that again, that's going to tell us a great deal of information. So we'll be able to revise it slightly, hopefully, to add the questions that we need that we didn't ask before. But then also, how is that going to show our long-term impact? Is what we're doing working? Have things changed? What has changed? Is that change significant statistically? And I think it's also important to continually gather data. So it's not a one-time, you're done. It's a continual process and from a number of different people and sources. And it comes in all forms and sizes, quantitative, qualitative, formal, and informal. As much as I love the research and the data piece and an academic, I'm also a pracademic of, okay, what's the practical reality? What's the application? What are other ways that we can collect this information? And then using it to develop prevention initiatives and programs and or tailoring those. So you don't have to create a new program, but what is it that you need to switch or include based on this group of students that you've collected from previous presentations, from meeting with staff who work with those students, or from your climate survey. And then use it to develop prevention programs. I've already mentioned that. Collect data to measure long-term impact. And so that could either be a climate survey long-term and potentially partnering with a faculty member who can evaluate long-term impact and change, or it may be a 3-month, 6-month follow-up from your prevention initiative. And then I always emphasize that student feedback and input is key on creating change. So if that's having students look at the climate survey and getting feedback before you send it out, if that's doing focus groups, if that's doing guided discussion, I think that they're key in helping us better understand their environment in terms of prevention and education. So hopefully I've covered quite a bit, so I'll hand it back over to Ashley to help facilitate our questions, or she may have some questions that she's collected along the way.
Yeah, thank you so much, Leslie. That was great. Thank you to both you and Jane. So there was a question a little bit earlier for you, Leslie, from Amy. It was when you were talking about the It's on Us Student Summit and the questions that you had at the different tables. So Amy said that I'd love to see the questions you used if it's possible to share. I know Jane provided a link to your actual climate survey report in the text chat. So I don't know, Amy, if that answered your question or if you were looking for those specific questions that were at the student tables. And Leslie, I don't know.
I can. Sorry, do you mind if I can definitely share them. I'm actually pulling them up right now.
Great.
And I was at a meeting on Thursday night with student groups in a panel, and I told them, I was like, we need to do this again because I want to look to see if the recommendations, if we still need to follow what the students recommended, and I want to check off what we've done, and then I want to revise. So, for example, we had questions on, well, I guess the outcome was they talked about engaging men, resources, education and training, alcohol and consent, marketing and messaging, bystander intervention, supporting survivors, and graduate students. I'm happy to share that. So if you want to email me, you can do so, or I can, Ashley, if there's another way to share that, I'm happy to do that as well.
Sure, yeah, we can add that to the page for this web conference and make that accessible that way. So we'll get those up for folks. There is another question, and this is from Courtney. And Jane, maybe this is something that you can help answer too, because it's around gathering data about perpetration. So the question is, do you do that? So Leslie, that might be the question for you, but then how do you go about doing that? And so Jane, if you want to jump in on that too, I think it would be great to hear from you both.
Sure. Well, I'll say really quickly, I think that we need to know a lot more about perpetration, both kind of in the research, kind of scholarly literature, as well as on our campuses. I think there are some validated measures that are available that are incorporated into some climate studies. COST has got perpetration measures, and I've seen climate studies that have perpetration measures. That's probably where I'm most familiar with seeing data on perpetration would be through the climate studies that have the COST perpetration measures. And maybe Leslie can talk specifically about what they're doing on their campus. But I think this is really an area where we need more data.
Absolutely. Thanks, Jane.
Mm-hmm. Yeah, I'll add, I don't believe we're in the process of collecting perpetration data, at least not through anonymous survey. I think more of us helping understand what's happening in conversations with our sexual misconduct investigators and our hearing panel officers, and trying to identify the trends and themes are probably as close as we're getting. I think Zoe Peterson, I think that's her last name. I think she's done some work on perpetration data, and I'd need to connect with one of my colleagues, Justin Garcia. We talked about this, and we talked about including it in our climate survey. I think for us it was a partial issue of length of the survey because the survey was very long, as well as the purpose of our initial purpose, and so it didn't make sense to include it when we conducted our climate survey. I think it's important to look at the measures and how they're asking in a way that people actually understand honestly, Like, have you, had sex or X, Y, and Z with somebody who's been drunk, or intentionally gave somebody alcohol use or drugs as a means of sexual engagement? We did talk to Dr. David Lisek, who we brought in with a grant from the Indiana State Department of Health a year and a half ago about this, and he said the one thing that we have to be careful on is, are people going to catch on? And because there's so much awareness about this issue, are they going to catch on and recognize that that's what we're asking them? And are we going to get real, actual data?
Yeah, that's a big one. And we could probably talk about that for a lot longer than we have time left, unfortunately. There's another question from Lorraine about any advice for community colleges.
Yeah, well, I have some thoughts for community colleges, and actually Prevention Innovations is doing a lot of work with community colleges in our own state and beyond. And I think, community colleges shouldn't be that different than residential campuses as far as data. I mean, I think that more and more community colleges are doing climate studies. There are other data points that are available at community colleges. So I think it's Lorraine, to really just think about, even if you could get a group of key stakeholders together on your campus or as part of your system, to really kind of brainstorm what are the data points on your campus, or if you're part of a larger system, part of the system. But I think community colleges have data points much like residential campuses do, and they might be different data points, but there should be data points to mine.
Great.
Yeah.
And
wait, can I answer that real quick, Ashley?
Please, absolutely.
Something that our university-wide system has done. So we have 8 campuses, 2 core campuses, and 6 regional campuses that all have different characteristics and cultures and personalities as well, just as our IUPUI, which is in Indianapolis, and our IU Bloomington campus have. What our colleagues have done is they took our climate survey that we did here in Bloomington and revised it slightly, and especially to look at other forms of sexual misconduct, and then also worked with the different campuses to adapt it. They're still in the process of collecting and working on those reports, and I bet that they'll be on our IU-wide Stop Sexual Violence website most likely once they're all done. So if somebody wants to come back and look to see what's maybe one of our campuses in terms of trends and themes, I think it's looking at, it may not be student to student, which campuses can't necessarily respond to in terms of Title IX and sexual misconduct policies, but looking at what are the different issues that students experience with, we hosted a conference in August that IUPUI hosted. How do we reach commuter campuses and non-regional campuses, non-residential campuses such as our regional campuses, and what are other areas to do prevention in that type of work? So once we have that, I can maybe share it with Ashley, but I think that that's definitely a need, and some of our other colleagues are working on in terms of looking at what are some of those trends and themes, and if we can't respond through our conduct processes, what are some other ways that we can be sure to tailor our efforts for prevention, especially with non-traditional students.
Great. Well, thank you. And just quick, Vera had a comment about, being careful about the ways in which we go about collecting perpetration data. Says you really need contextual information that many studies do not collect, or they try to collect the contextual information in a way that isn't adequate. So I just wanted to highlight that. So, gosh, how do 90 minutes go by so quickly? That's always my question. But Jane and Leslie put together this wonderful list of resources on all of these different topics: climate studies, program evaluation, readiness to change, and readiness to engage in prevention, needs assessment, just some general prevention and intervention mapping. And that is available at this link that I've also put into the text chat several times, and I'll do it again. You can get that now. So thank you both so much for putting that together, because it's great. It's a wonderful list. So I'm going to put that there. And then Jane and Leslie have also graciously shared their contact information with us. So you all, sounds like you can reach out to them through email. I want to really quick just highlight Prevent Connect campus also has some other resources, including our national scan reports on prevention. So you can check that out. And I just, again, want to thank you all in our audience for this great conversation. Catherine's asking me to go back to the speaker's contact info. I'm going to do that for you, Catherine. There you go. So thank you all again for this wonderful conversation. As I said in the beginning, please let me know if you have ideas for topics that you would like to see specifically around prevention on campuses. And Jane, Leslie, thank you both so much. This was really wonderful, and I hope useful for our audience members. I know it was useful for me. I learned a lot, so thank you both so much.
Well, thanks for the opportunity. Great.
Thank you. Thanks for having us.
Yeah, of course. So this concludes our web conference today. You will all receive a follow-up email with a link to a survey evaluation, and in a couple days I'll send an email out with a link to access the recording of this. As you know, I'll try to get those other worksheets that Leslie provided up on the site this afternoon, so you'll be able to access that. Thank you all so much. Have a wonderful rest of your day, and we hope to see you on future Prevent Connect web conferences. Take care.
Thank you.